And in a typical heart, like Jasmine's is a typical heart, the heart is oriented just like it is in you, so right and left. So the right side's on this side, the left side's on this side. The right side is smaller than the left, and that's normal. Hers is that way. The right side pumps blood to the lungs, and the left side pumps it to the body. Or I say the brain, the body, and the big toe, because that's about as far as it can get, right? Blood comes back to the heart from veins, so it's going, the big veins that come from your legs, they're the inferior vena cava, and then the big vein from your head is called the superior vena cava. So the blood's coming back to the right side of the heart, goes into these chambers. This is a pulmonary vein. So blood comes back to the heart on both sides, one from the body, one from the lungs, and it comes into these two chambers that are filling chambers. They're called atriums. Okay, so just like a building is like an atrium. When you walk in, that's where you go in to start. So the right atrium and the left atrium, or the atria plural. Okay, these are smaller chambers. They're filling chambers. They do pump, but they don't squeeze as hard as these pumping chambers down here. Blood goes through these two valves. This one is called the tricuspid valve, and it looks like a peace sign or a Mercedes if you're looking straight down the barrel of it. So tricuspid valve, 1, 2, 3. I think that's why they called it that. And then this one is called the mitral valve, and it's got 2 flaps. Okay, so it's not a peace sign, it's got 2 flaps. And then it comes into these big pumping chambers. So this is the right ventricle and the left ventricle. These are more muscular. They're the ones that are sending blood out. So when they squeeze, that's what you see when you see that EKG go up like that. Mm-hmm. That's those ventricles popping. Okay. So that's why you get that big inflection on the EKG. And then that's why it comes down, like where it goes like that, comes back up. That's the 2 ventricles pumping. And then this is them relaxing. Okay. So that's why it comes down like that. Okay. So these 2 valves are called the aortic valve, and this is the pulmonary valve. Okay. So this is normal. This is normal anatomy. Okay. What your medicine that you're doing is helping prevent seizures. Right. So it's a serotonic 5,1-ATL drug. Mm-hmm. So that agent increases, or has the potential to increase pressure. You can't get that. In your pulmonary arteries. So your pulmonary arteries right here. Mm-hmm. So it can increase pressure this way and create pressure on your pulmonary valve and make it hard for her to breathe. Okay, so shortness of breath, right? Okay, so shortness of breath, we do the echoes to make sure that she's not having any issues with a valve, an artery, or the right ventricle. Okay. So when people, like in the general population, when people have heart failure later in life, okay, the primary problem or the primary reason why people develop heart failure is not because of like a heart condition they're born with. It's because typically people have a little bit higher blood pressure than they should, maybe don't exercise as much as we should, and so you get all this extra pressure back this way on the heart, okay? And so what happens when we increase pressure? So if you've ever done weightlifting, the only way to build muscles is to build the resistance, right? So those football players are throwing plates on there trying to build their chest. They do all this bench pressing. So the more resistance you add, the bigger the muscle gets. Well, just imagine you start increasing your blood pressure. People start getting blood pressures in the 150s, 160s every single day. Well, that ventricle is a muscle. It's having to beat against resistance. So what happens? It starts to get thicker and thicker and thicker. And this valve right here is subjected to pressure this way, and it starts to deteriorate. So most people that develop heart failure later in life, it's related to blood pressure, okay? The same thing can happen with medications on the right side. So medications can increase pressures in the lungs or in the arteries that make pulmonary hypertension, not systemic hypertension or high blood pressure on the right side. So most anti-seizure medications or seizure prevention medications can raise blood pressure. I mean, that's pretty classic. So I know you've been on a number of different medications. Depakote can do that. Epidiolex can do that. I'm butchering some of these names. It's been a while since I've said them. But a lot of those medicines are classic for elevating blood pressure. So a lot of times when people have high blood pressure on those medicines, then we do an echo on them too, just to see how their left heart is doing. Yours is more about right heart.
Okay.
We're looking at left heart too. We don't just go, okay, how's the right heart? We look at all of it. But the main reasons why the FDA recommends that kind of screening serially is because of the risk for pulmonary hypertension.
Okay.
Is that clear?
Yeah, I have a question.
Please.
So that's what I was just explaining to the doctor. She said, have I noticed anything? Only thing I have noticed is her not walking far without out of breath.
Okay.
Now, is it new or abnormal? With her, she can't walk anyway far because it triggers her seizures. So now she's like out of breath. You can almost tell she started trembling so bad and she's out of breath. So I don't know
if it's
the medicine or not.
Yeah. My knee jerk to that is that the medicine has been on board for less than 6 months.
Yeah.
And I think Dr. McGregor commented that it takes a while for it to really get rolling.
Right.
My suspicion would be that you're just competing with a bunch of different things. Like it's hard to be conditioned. I mean, if I'm hurt, I don't want to walk if I know that I'm gonna have a seizure, right? Like anybody that isn't doing a lot of activity, when you start doing activity, you're gonna get really tired, and short of breath, and it's been hot as you know what.
Yeah.
It's finally like not feeling like that.
Right.
So there's a couple different things that play in that way if it's outside and things like that. My thought would be that if her 7-day monitor is okay, and we're still within the parameter for doing the echo, that we'll just do the echo in November.
Okay. That's fine.
And that's the reason they put that interval is it's almost like the reason why you get colonoscopies every 5 years is because a polyp takes 5 years to develop.
Okay.
I have a feeling that they wouldn't put that interval at 6 months if there wasn't a reason for that 6 month interval.
Right.
So what did I see on the echo from May? Okay. Very normal looking heart.
Okay.
Amidst all the things you're having to kind of juggle, the anatomy